I'm at Philips Israel here, and I'm talking to David Orenstein from EPD Solutions. And EPD Solutions was a startup which was grown up, and then 6 years ago was integrated into the Philips organization. And we're going to talk about how it is to be a startup and to be integrated in Philips, and what the solution entails, and what kind of developments may are. Okay, David. First, can you describe EPD Solutions in the overall way?
Hi, so EPD Solutions is a company that was set up to really address the needs of electrophysiologists in cardiology, to really have a system for 3D imaging and mapping that can give physiological feedback to the physician to increase the success of their procedure, shorten the procedure time, shorten the amount of radiation, and yet still encourage the success of the procedure for the sake of the patients.
Yeah. And it's hardware, software, and little kits or something like that. So the hardware is about 250,000, and the software license, I don't know how you sell that. Is it cloud-based or is it? It's
currently not cloud-based. We have the hardware, we have the software. Most of our updates that we are doing, because we're in a fast growth and startup phase. So we're doing 3 software releases a year.
But is it cloud-based or is it on-premise?
It's on-premise. It's on the system.
But it gets automatically updated. You don't have to. It's got automatically updated process.
We have a technician that will come in and do it to do the update process, and not only that, test the system, and it'll be part of the annual or the periodic testing of the system.
Yeah. So you have sophisticated viewing. So all these pictures, and you have all these ways to basically get out of to get a beautiful view out of it. And the software is on premise. What was 6 years ago? That company was started. I think 6 years ago.
It was actually about 8 years ago.
8 years ago.
The company was started by Shlomo Ben Chaim, a serial entrepreneur, especially in the cardiology field. And the goal was to develop a open system that is physiologically based to give real-time feedback to the physicians, with the choice of it being an open system that the physician can use any catheter that he chooses that is validated on our system, but that he can choose where the technology is based in the system and not in the catheters, and therefore lower down the cost of the procedure while still increasing the efficiency and the accuracy with a system that is got a much simplified workflow than existing systems on the market.
Yeah.
So
and it was integrated in Philips how many years ago?
Right. So that was a brainchild 8 years ago. It took 3.5 years of work for them to reach the stage of CE and FDA approval, which is incredibly fast. From
a lot of times it's 10 years is nothing, right? I mean, it's just like amazing.
And this is 4 years to development, CE and FDA approval, and acquisition by Philips. And Philips has been nurturing us from within, not instantly imposing the culture and protocols of Philips on us, but nurturing us within, still maintaining that fast growth period that we're going through. And we've now been within Philips commercially for the last 4 years.
Yeah, you grow still 100% a year, I think, eh?
So we're growing year on year incredibly, also with the number of sites that we're working with, and with the sales that we are achieving.
So you say you're growing very fast. You have been integrated by Philips slowly, and you say it's an open source system. You say you're also late to the market. There's a lot of competitors. What are the advantages? What are the practical advantages of your system? And what does open mean?
Okay, so open means that we are able to work with catheters that have been developed by other vendors, and we can still have advanced features like evaluation of ablation catheter contact with the tissue without having any technology built into the catheter, because it's built into the system. So we can work with catheters from a range of vendors. So instead of spending 2,500 euros on a catheter, you can take a 900 euro catheter and still have a similar outcome with hopefully much better success, because we can also get the physiological insights which we're currently developing, such as tissue thickness, quality of ablation, contact of a catheter, and that is in a system where we're trying to reduce the amount of, when building that image, that 3D anatomy that you saw with the system, we're trying to reduce down the amount of contact you need with the tissue and try to see beyond the catheter in order to provide a solution where you can get accurate anatomy, but with minimal invasiveness and with minimal contact with the tissue necessary.
And then we saw also the whole procedure went from 3.5 hours to about 80 minutes, and it's going down to 7 minutes, so it's less time. The cost is going from 8,000 to 5,000 euro per procedure, and also you have higher quality of imaging and that kind of stuff. Where is the software that this whole solution was now created? Where is it sold internationally?
Excellent. So the software was originally developed in Israel and Caesarea. Still, our main R&D body is actually in Caesarea, and it's doubled in size since acquisition. Since then, we've also added development, research and development in the Netherlands, in the Benelux region, in our facilities in Best, and we have advanced development now coming out of Cambridge in America, which is a great location. All of that, we are currently...
Who's using the system? Which countries are you implementing? And
so we are currently commercial in America, Europe, Israel, and we're looking to be, and China, and we're looking to be expanding hugely over the next year, including the Japanese market, and further beyond that with the Middle East as United Arab Emirates and so on.
Yeah. So the cost of the cost is 5,000 to 10,000 per procedure. Who needs something like that? When is your heart so ill that you need such an expensive diagnostics procedure?
Okay, so the cost of procedure does vary because it depends what catheters you're using. When it comes to us, the cost of our side of the procedure is first of all the cost of the system, and then the cost of the sensors that we stick on the body of the patient, and that is a low cost item, and then you can add to that the catheters, which you can choose whichever vendor that you might have agreements with, and therefore.
But I mean, who is needing this kind of procedure? Because I mean, it is an expensive procedure, left or right, even though it's half the price. It's still like a lot of money. Who needs that?
So this is being used by electrophysiologists are performing ablation procedures for cardiac arrhythmia. So anyone that has a heart rhythm disorder, whether it's coming from the atrial or from the ventricles, our system can be used to be able to treat.
How many people are that in a normal population?
Wow. So that's a large number. I believe the most common arrhythmia is called atrial fibrillation, and they say that I believe it's a third of the population of the world will suffer from atrial fibrillation at some time in their life, and that's just one arrhythmia out of a plethora of different...
so it's large scale, lots of people, and this analysis, you need to basically come to a proper treatment.
Right.
Okay, so this company inside Philips can grow endlessly. How many people are involved totally now?
So currently, I believe we're already nearing or going over the 200 people within the business unit, where the vast majority of them are actually research and development. Because
that doesn't involve all the commercial people who are selling it everywhere and the technicians who are supporting it everywhere.
Right, so that's R&D, and then we have the technicians on top of that that brings up those numbers.
Okay. Good luck and thank you very much.
Thank you.